everybody, and welcome to Cope with Hope. Today, I'm interviewing my dearest family doctor, Rohit Barman, who's been by my side and my family's side for many years now. And he's like a pillar of strength for me in every way. And I was waiting to interview him so that he can give you news and information and advice about what is the best thing we can do at this time. So thank you very much, Rohit, for agreeing to do my show. And
So,
I'd like to ask you what you've been doing during the lockdown, though I know you what you've been doing, but I'd like you to tell the audience.
well, unlike a lot of people, this has been probably one of the busiest times of my life.
Yes,
And because I have decided that, and of course, not only decided, and the hospital really required us, to put up our hands and look after the COVID wards and the COVID patients. As you know, Bridge Candy Hospital, like most hospitals in Bombay, are looking after a lot of COVID patients. In fact,
yes,
myself and colleagues of mine, we've almost sent home almost 400 patients in the last 3.5 months. So we've been extremely busy,
yes,
extremely active.
yes,
And of course, it has a high risk, of course, to us. But at the end
yes.
of the day, we are doctors, and this is what we become doctors for, to serve humanity, to serve medical epidemics and pandemics. And this is what I've been doing for the last 4 months, been in and out of Rich Candy Hospital, going to the COVID ward, seeing all my patients, and reassuring them that most of them are going to get well soon. And of course, in the bargain, we've lost a few as well, but that's been very few. And those people have been, elderly with comorbid conditions like, serious complications. But as I speak to you, one thing I can tell you is that Bombay is, at the moment, there's a deluge of patients here. Even though we are 4 months down the line, we're probably peaking now, or maybe peaking in a few days' time.
Okay,
We're seeing on an average in Bombay almost 1,500 patients of COVID a day on an average. And almost all the hospitals, whether it's Bridge Candy or Just Lok or all, we're all being controlled by BMC, especially for the COVID section
yes.
of medical treatment. And we are, 80% controlled by BMC. So, and most of the hospitals are absolutely packed.
Good.
And also the ICUs are packed. At Bridge Candy, we have almost about 35 beds for COVID patients, and plus another 10 in the ICU. So almost 50 beds are occupied by COVID patients. And
Okay.
every day we have a demand of about 10 or 12 who want to come in. So we have been extremely busy during this period of time.
So, Rohit, tell me something. Uh, what do the families do once the person from the family goes into hospital? Are they allowed in any way to be in touch at all or not at all?
Yeah, they are allowed to be in touch more on phones and other things,
Okay.
The patients who are COVID patients, they're highly infectious. So they're all, in their rooms in the hospital, and they're looked after by the doctors as well as the nurses at our hospital. And we have a proper protocol which has been established,
Yes.
where every doctor goes on a different day for rounds and sees all the patients.
Okay.
And we follow a protocol. But unfortunately, as far as the relatives are concerned, whether it's your mother, sister, child, they can't come and visit the patient. But they
Okay.
can talk to the patient on the phone.
Yes.
And, this is all for various reasons. The doctors are also at risk. The nurses are also at risk. And we are in a very highly sensitive position at the moment. So I don't think any hospital is allowing any relatives to come in
At the
directly
moment.
visit the patient. Yeah, at least not at Rich Candy.
Okay, so tell me, if you fall sick and you think you have COVID, what should you do?
Right. So the first thing to do is not to panic,
Yes.
because COVID is, by and large, 90% or 95% of almost all COVID patients are going to recover.
Yes.
And it is basically just like a bad attack of flu. So first of all, don't panic. Okay, you're going to be okay. primarily you've got to believe you're going to be okay. So you're going to be all right. What you need to do then in that case is if you've got very bad symptoms of cold, cough, high fever, breathlessness, etc., you must get a COVID test done to know whether you have COVID or not.
Yes.
For various reasons. One is not only even if you have mild symptoms of fever and cough and cold, it is a highly virulent virus. Virulent meaning it is extremely infectious, and unlike any other virus like the influenza virus or something, this is almost 5 to 10 times more virulent. That means the chances of you getting it or spreading it to others is about 10 times as opposed to
Others.
the normal viruses. And when it is such a virulent virus, you have to immediately self-quarantine yourself or self-isolate yourself in case you've got it. Because, there are obviously many people living in a house and it's very infectious. So and that's why when you see all the famous people who live in one house, if one gets it, generally multiple people get it.
Yes.
And even in buildings and complexes, you must have seen that if you never hear that only one person got it in that building. You always hear 8 people got it, 10 people got it. It's an extremely virulent virus. So it's very important for us to make a quick diagnosis.
Okay.
And of course, you've got to inform BMC. And if you're by and large okay, you're relatively young, you don't have any comorbidities like diabetes, blood pressure, heart, cancer, etc., you're not on any kind of medication, etc., and you've got mild symptoms, you can well self-isolate yourself and self-quarantine yourself at home.
Yes.
And it's only if you are breathless, you're uncomfortable, you're old, you have comorbid conditions that you really need to venture and get admitted to a hospital, especially if you have an adequately big-sized apartment with a nicely well-ventilated room.
Okay. So tell me something. If you have the symptoms, you should immediately call your doctor and make arrangements to have the test. Is that what you should do?
I think that would be the simplest and the easiest thing to do. And nowadays, previously BMC had restrictions on only symptomatic patients could get tested, but now you don't even need a doctor's prescription, I believe, to go to various hospitals and diagnostic centers and pathology laboratories. You can, if you have even the slightest of symptoms, you can go to the laboratory, and if they feel that you are the right candidate, they'll do your test for you.
They'll do the test. Okay. All right. Another thing for Aam Janta, for people like us who are generally at home, what is the advice that you have to give?
So at the present moment, it's very simple advice. It is highly infectious. So you've got to stay at home as far as possible. I know that it's getting frustrating for a lot of people because it's been 3 months and 4 months. Staying at home becomes an impractical thing. If you have to go out, make sure, I guess time is going to come when you're going to learn to live with the coronavirus, because in my opinion, it's not going anywhere. It's going to be here for the next 6 months, if not a year. And that's going to be even more frustrating. So what you need to do is absolutely you cannot afford to be lax at any time, because the virus is extremely violent. You must wear your mask the moment you step out of your house. At home, keep sanitizers, clean your hands, sanitize the floor, sanitize the sofa, sanitize the doorknobs. Make sure you wear a mask when you go out. And not only make sure you wear a mask when you go out, ensure social distancing.
You were telling me what people like us should do. I mean, should we go out? I haven't gone out at all, but what should we be doing?
I think it's a very wise idea to stay at home if you can. And if you don't need to go out, don't go out. And if you need to go out to buy groceries, shopping, or something very important, then make sure the most important thing in this whole thing is social distancing. You must ensure that you're at least 6 foot or 5 foot away from it. Because it's almost established by World Health Organization that this virus is transmitted through the air. It's not that they're saying that it cannot be transmitted through knobs and contacts and tables, etc. But primarily, it's a respiratory virus, and primarily it's traveled through the air. So I think, and it's a heavy virus, so it does sink very easily. And the distance of 6 foot is generally considered appropriate. And make sure you wear a mask when you go out. Make sure you sanitize your hands, legs, whatever you need to do. You need to wash your hands innumerous amount of time, and be very cautious. of
Okay.
people. Just keep everybody at distance. Avoid socializing, avoid hugging, avoid meeting too many people. You cannot trust anybody because asymptomatic carriers may be there as well.
Yes.
By meaning that a guy like me who's exposed to the hospital could be an
Yes.
asymptomatic carrier. So
Yes.
meeting a person like me is a dangerous proposition.
Absolutely.
Yeah,
Though I
so
want
that
to
kind of
meet
stuff.
you.
Yeah, but you can that's what they're doing. All the politicians when they have meetings, all the companies now. That's why Zoom and your
Yes.
WebEx calls are becoming very, very thing. The problem for doctors is that unfortunately we've been now resigned to practice most of our medicine on videos, on
Yes.
video calls and
Yes.
consultations, and
Yes.
almost all doctors, even the ones which uh, which don't even like to do video calls are enforced to do it. And of
Yes.
course,
Yes.
I mean, you can give an advice, you can give an opinion on a video call, but unless you clinically see the patient and unless you clinically feel the abdomen, if the patient has
Yes.
an abdominal pain, and that little relationship between the doctor and the patient when the patient meets the doctor,
Yes. That's
loses
important.
its luster, especially in the video consultation. But anyway, at least if not anything, we can help our patients on video consultations, guide them a
Yes.
bit, and
Yes.
at least sort of make sure that they're somebody is there for them to look after them.
Yes. Yes. It's so reassuring for me to know that you're there for me.
No,
And
pleasure anytime.
thank you. Really, God bless all you doctors. And I hope that you're taking care of yourself also really well, Doc.
Yeah. Well, we try as best as we can. Yeah, we're trying to keep it. We are always aware because we go to the hospital all the time. So we have
Yes.
to be there, cautious. We have to wear our proper protective gear once we are in the hospital and make sure a slight lax, the virus is all over the place. So a slight lax on our part is going to put us as a subject to this. So therefore, the most important thing here is, you see what happens as time goes on and you haven't got it, you tend to get a bit complacent. You tend to
Yes.
say, oh God, nothing's going to happen to me.
Yes.
And that's when people get hit with it. Even when you start going out, when you start going to work, you just got to avoid crowded areas. You just got to avoid closed, densely populated areas. Try and go
Yes.
out only where there's a little relatively open space, where there's proper ventilation, etc.
Yes.
And make sure that you don't go to people's houses and have parties, etc. at this present moment of time, because you don't know who could be the asymptomatic carrier.
Yes.
Protect yourself. That's the only way to do it,
Yes.
because you may not be worried about yourself, but you may be going and visiting elderly parents or elderly people who you
Yes.
may carry the virus to, and the disease
Yes.
could be quite a serious issue for them.
Yes.
They may not make
Absolutely.
it if they get the disease. So this is the important thing about the COVID virus.
Yes. And where do you see the future in this? Can you see a future?
Well, at the present moment, the virus is very young. I mean, it's only been in the world. It was, as you know, in Wuhan
Yes.
in December, which is not even, we've just about gone through 6 months,
Yes.
6 months of the virus. And to be honest with you, at the present moment, there are lots of antiviral drugs which have come out. I don't think they're really effective against the virus. There's
Okay.
favipiravir, which is in clinical stage. There's remdesivir, which has come out. Well, some doctors feel they marginally help some of the patients. My experience has been that it really doesn't seem to do much.
Okay.
But yes, what really helps people once they're hospitalized is good oxygenation. That's what's very, very important. And sometimes you need to give them blood thinners because they have tendency to get clots.
Yes.
And also sometimes steroids have been very, very helpful in patients which are mild to moderately severe cases. But besides that, the other drugs like antibiotics and antiviral drugs have shown very, very limited scope in this present virus. As time goes on, I'm sure some vaccine will come across, but I don't anticipate anything to come this year. It's too premature. I think maybe by middle of next year, if we're lucky, we will have a vaccine against the coronavirus. But I think coronavirus is going to be with us for a while, and we've got to learn to live with it over a period of time.
In a sensible, safe manner.
Absolutely. I think the way of life is going to change now. As it is, you can see everybody's methodology, thought processes, concepts of life has suddenly changed in 6 months.
Yes, yes.
And well, unfortunately now people are getting a bit more weary, and this is going to be how life is going to be,
Yes,
at least for the future, with a lot of caution. Air travel, train travel, bus travel, commuting, meeting people, etc. Will have to be in a much more controlled and a different manner than what one was used to.
Okay. Like I asked Doc if I can go fly to Bangalore, and he says no. He told me directly, no. You stay put where you are.
If it's not really urgent, I think this is not really the time to, because, first of all, the illness is there everywhere. It's there in Bangalore, it's there in Bombay, it's there all over India. And if you see the numbers as it's 13th of July today, and the numbers are probably the highest in India on every day we're breaking a record of cases. So it's obviously, everywhere. If you don't have to go, the work is not that urgent, or work can be done without you going. Now, a lot of works, jobs are being done. I mean, people used to have meetings for 4 or 5 people in their rooms. It's not necessary to have those people. You can have them on Zoom, and you can have them on webinar. So have those meetings. Call people to your office and rooms only if it's absolutely necessary.
Okay, fine. Doctor, thank you so much. This was very, very helpful.
Pleasure, Navi.
And I hope everybody listens to all this. Thank you.
Thank you, Navi. All the best. Bye.
Bye. Thank you.